Most people make the same mistake the second that something hurts. They'll stop. But that is exactly why they have trouble getting better. You don't actually get better by stopping. You get better by appropriately adjusting your training. The goal, and this is going to be a hard one for a lot of you to wrap your head around, but the goal is not to have zero pain when you're returning. The goal is to have tolerable loading, intolerable ranges, and the ability to do the tolerable loading and ranges consistently. And this is where people mess it up. They go too hard right out the gate. Then what happens? Can't train the next day. Whatever it is starting to feel worse. You begin losing momentum, and now you're not making any progress. You are de-training yourself, and then sensitivity will start to go up. Even if you're coming back from some sort of tweak, pain, injury, you need to have some goals about returning to training. And then when you do, you need to say to yourself, I do this in a way that I can train tomorrow, that I can train the next day after that I can train the next day after that. You see where I'm going with this? And you have to think every time that you train, you have to ask yourself these questions. Does what I'm doing hurt while I'm doing it? That's question one. Is there some sort of spike or increase in my pain and symptoms after the set? Does this leave it more difficult for me to train tomorrow? And that last one is everything. Because if what you're doing is going to ruin your ability to work again tomorrow, then you have gone too far. It's the only way to bring these sensitivities down with pain is with consistency. So you have to think to yourself, we're not going to stop training. We're just going to adjust training. And you may need help doing that. You can always reach out to somebody. But if you've trained long enough, this is something you should be able to think about. Can't lunge? Let's get out the sled and push it. Can't press overhead with a barbell or a dumbbell? Maybe switch to a landmine version. Deadlifting has been bothering your back lately? Shorten the range of motion. Change where you pull from. You get a similar pattern, but you bring the stress down a little bit by altering some of those other variables. Unfortunately, most people give control up to somebody else once they get hurt or have pain in training. That you have the control. You can get out of this. You just have to have a little guidance sometimes. Or you have to think a little. And what can you change? You can change your range, your tempo, the loading, the volume, the angle you're working at. You're not stuck. You're just making adjustments as you're trying to work through this. The big thing to keep in mind is discomfort will be part of the process. And that's the part that a lot of people are not comfortable with. You can't sit back and try to eliminate all pain and discomfort, because then you're just going to eliminate any progress you can continue to make. You need to learn that difference between productive discomfort and harmful pain. So don't just stop. Don't just stop training because something starts to hurt. Sit back and change how you're training. Look at the variables you can control and manipulate to continue to make training as comfortable as possible. And then slowly, consistently, frequently build back up.